How deadly is scorpion venom for humans? Scorpion venom can be highly toxic and, in certain cases, deadly to humans. Scorpions are arachnids with a venomous stinger at the end of their tail, which they use to immobilize prey or defend themselves. While there are over 1,500 species of scorpions worldwide, only around 25 species are known to have venom potent enough to be life-threatening to humans. Here's a detailed overview of the dangers and effects of scorpion venom. Scorpion venom contains a complex mixture of neurotoxins, enzymes, and peptides. These neurotoxins primarily affect the nervous system, disrupting normal nerve function and leading to a range of symptoms, from mild to severe. The venom targets ion channels, particularly sodium, potassium, and calcium channels, which are critical for nerve transmission and muscle function. The severity of a scorpion sting depends on several factors, including the species of scorpion, the amount of venom injected, the age and health of the victim, and the location of the sting. The effects can range from mild discomfort to fatal systemic reactions. The sting site often becomes red, swollen, and intensely painful. The affected area may feel numb or tingly for a few hours after the sting. Some individuals experience mild muscle spasms or twitching near the sting. In more severe cases, particularly with venomous species like the Arizona bark scorpion or Indian red scorpion, the venom can cause life-threatening symptoms, such as the venom can spread rapidly, affecting the nervous system and causing widespread symptoms. Neurotoxins can impair respiratory function, leading to shortness of breath or even respiratory failure. Venom can cause abnormal heart rhythms, arrhythmias, and, in extreme cases, heart failure. Severe neurotoxic effects can lead to seizures or involuntary muscle movements. In rare cases, victims may go into shock due to the venom's impact on the cardiovascular system, which can be fatal without immediate medical intervention. Children, the elderly, and individuals with compromised immune systems are particularly vulnerable to the effects of scorpion venom. In these cases, a sting that might be less severe in a healthy adult could become life-threatening. Due to their smaller body size, children are at a greater risk of systemic envenomation, leading to more pronounced and dangerous symptoms.